Welcome everyone to the Lymphie Strong YouTube channel. Today I have two very special guests here with me from way across the pond. They're overseas in the UK, and I believe Mr. Hawking is based in Wales. So I have today we're going to talk about what should health professionals and families know about children and young people with lymphedema. My two guests are in the middle of a research project that will hopefully provide some insight on what children and young people with lymphedema are dealing with, and how health professionals can become educated and hopefully develop programs worldwide, like the one that's been developed and led by, excuse me, Mr. Carl Hawking in Wales. Excuse me. Dr. Rhian Noble-Jones is not a stranger to the Lymphie Strong community. She lectured for us before on genital lymphedema. And if you want to look up that topic on my channel or in our group, that information is on lymphiestrong.com. And if you're not familiar with what Lymphie Strong is a global patient advocacy and support community that helps people living with lymphedema and lymphatic disorders of all types. So without further ado, I want to introduce my two guests. Their credentials are extensive, so I'll allow them to tell you all about themselves, and then we'll get started with the webinar. Dr. Noble-Jones.
Thank you, Veronica. Thank you for inviting us again. Always good to share with your family. I'm the researcher here. I'm going to hand over shortly to Carl to do the first part of the thing, but just to say, as the researcher on the team, I'm also a certified lymphedema physical therapist and did my stint in working with children that had very particular needs before really I became a specialist in lymphedema. So in my head, I'm now having to put these two pieces of information together. Carl, on the other hand, has a much better track record in terms of pediatric lymphedema, and I'll let him tell you. But just so that we've got the context, and I know a lot of the Lymphie Strong family will know this already, but I'll just take a step back to define what we're talking about here. That lymphedema in children and young people can be primary or secondary and can show at any age. The children could have it as consequence of cancer, infections, things like filariasis, consequences of cancer, chronic inflammatory conditions, particularly of the skin, or trauma, of course. But the biggest group that we see are those that are children with primary lymphedema, and it may be associated with genetic or vascular or other bigger syndromes. The diagnosis of that particular group has been helped considerably in the last 10 years by the publication of a flow chart, if you like, that helps medics diagnose primary lymphedema in particular. But we'll talk a little bit more about the impact of that and perhaps the disappointing lack of, to a certain extent, a little bit later on. So I'll ask Carl, Mr. Hawking, if you can introduce yourself, please, and then we'll get started on the slides.
Hi, thanks, Rhian. First, I'd like to start with, thanking Veronica for the invitation. I'm really excited to talk to everyone about our Children and Young People Service in Wales. I'm Carl. I'm an occupational therapist by background with a passion for pediatrics. I'm relatively new to lymphedema to some of the others. I've worked in lymphedema since 2019, and at the moment I'm the Children and Young People's lead for Wales. So I'm really excited that the background of the service before I come into it, they've made some great strides in developing it, and since I've been in, we're learning stuff every day. So I'm here to learn as much from everyone else and all the patients that are out there. And look to take that back into our service. So I'm really excited to be here and tell you a little bit more about what we've been up to, and hopefully where we're going to go.
Great. So if we get those slides up,
Shall I get the slides up? Okay.
We'll
this is always the first challenge, isn't it?
Yes.
Ooh. Host as disabled participant sharing screen, so I'm not allowed.
Oh, let me allow, let's see. And I'll edit this out of the recording. Okay. Oh, there you go. Make co-host.
Here we go.
I'm going to go ahead and make Rhian a co-host as well. Okay, there we go. We'll edit that out of the recording.
How's that looking? Are we
Looking
on?
great. Yeah.
We're on. Lovely. Okay, so like we've already done our introductions, which is good. So like Rhian said, and Veronica, the service is an all Wales service. And the slides moving forward, just to make sure.
Yes.
They are, they're lovely. So a little bit of background about the service. In 2011, it was recognised within Wales that the children and young people with lymphedema were not offered an equitable service or proven service within Wales, which meant that they were either being seen in adult services, in adult environments with lymphedema, or had to travel long distances outside of Wales to be seen. So in November 2015, there was a Welsh Assembly government bid put in for a purpose-made lymphedema service, especially for children and young people within Wales. And then we were lucky enough to receive the funding and ongoing every year from then. So the aim of the national team, where the CYP team sits, is to support all the local health boards in Wales. So there's 7 local health boards in Wales. So we support the already in place lymphedema therapists to develop their skills to manage and to deliver a more effective service for this cohort of patients. And then I know that varies with age group within what's seen as pediatrics or what's seen as children and young adults or children and young people. But in accordance with the NICE guidelines that we have and in the transition services, our cohort covers from 0 up to 25 years age, which we've seen a really high benefit within the transition services then. So since we started in 2015, in 2019, we conducted an audit to look at how we were doing. Were we performing well? What changes had been made? What was the need of the service? Because there was a lack of literature out there beforehand. We knew these children were out there. We weren't entirely sure how the service needed to deliver. So in 2019, we completed the audit for the first 3 years of the Children and Young People's Lymphedema team. And I'm just going to go through a few slides in explaining the results of that, and then going to go through some of the stuff that kind of we've been doing and kind of the approaches that we use that we definitely feel are pertinent to children and young people services. So we found that we'd received 285 referrals in the 3 years that we'd been going. And that's at an age range of 0 to 25, and within Wales, there's a population of 909,000 there. So that was suggesting that in every 100,000 people within the population of that age group, there was 31 children or young people with lymphedema. And then that's also given us a score of 0 to 19, where some of our pediatric services only see people 0 to 19. That would suggest a prevalence of 27 people per 100,000. This in relation to the previous literature that we had kind of looked at, or through our research, we've trawled the journals to find, which only suggested that the prevalence was only 4. So even the first 3 years of our service, we're recognizing there's a far greater number of children and young people in our population with lymphedema. So to represent the age group then that we're seeing, as you can see, the majority of our age group at the moment is either late teens or early 20s. Again, there are more awareness now, hopefully, that we're going to be seeing these patients earlier, seeing these children earlier, which again is represented in this next graph. If you can see that, the This graph represents the age of referral. So this is when we are first aware of these children. So we're first made aware that these children are there. They referred to us. And then during our first initial assessment, we ask a question of when the age of onset was. So when do we feel that lymphedema become apparent? And quite concerning to me is that the blue columns, where you can see where the referrals that were made, the majority of the referrals, again, being made late teens, early 20s, and 25 and above. Whereas you can see from the green column that the age of the onset was far, far earlier. So these children, the age of onset, over 100 of our kind of caseload, the onset was occurred between 0 and 4 years old. And we're not having the referrals till much later, which again is probably an aim of one of our services to make sure that we're getting to see these earlier in their journey. So like we talked about, we really value patient feedback. And in order to measure how we're doing a good job, we use a patient-reported outcome measure, where we ask the patient various aspects of their lymphedema and how that bothers them on a daily basis. So within this questionnaire, they score aspects such as how much does the swelling bother you or wearing your garment. And they score that then between 0 and 4. 4 meaning it impacts on their daily life a lot. Oops, sorry, something's happened there. There we go. Can you see that okay now? So as you can see from this graph, again, when we're looking at have we done anything? Have we been useful to our cohort? And we have three different color columns. The first column, which is the blue column, which is how the patients reported the impact of lymphedema at their first assessment. So a lot of these patients have come to see us, not really understand what lymphedema is or what's going on. So the impact, and rightly so, I think, the impact on their daily life. So if you can think about along the bottom, you can see swelling, pain, range of movement, hobbies, wearing of clothes. It's having a great impact on their daily life. So lymphedema is having a massive impact on their general well-being and their general functioning. So what we can see by the second column, which is the green column, this is the impact that they've reported at their first follow-up. And pleasing to see, it looks like we're doing something well, because the impact that they're having on daily life has greatly reduced. You still have swelling, which is the main cause of concern, and pain, which again is quite consistent in being some of the top scorers in the impact of lymphedema. And then you have things like wearing clothes, wearing garments, again is having a general impact, which we would expect with a chronic condition that needs self-management. And a lot of what we kind of promote is self-management is key within lymphedema. And then really positively, the third column in red is the impact of their second follow-up, where we can see that again, from the blue column, where you're having over 300, the scores were in regards to swelling, and 300 within pain. We've greatly reduced that to under 50. So you're talking about 20 single figures in some, which I think is really positive in the impact we're having. And that could be a reduction in symptoms. It could be that the patients are understanding their condition more. So again, we're trying to look at what are we doing? What are we doing that's helping these people, these patients, and reduce the impact of lymphedema on their lives? Because as we know, a chronic condition can be a burden, and self-management is key. So moving on from the audit, then what we've been doing since the end of 2018, excuse me, our numbers and our knowledge within lymphedema continue to increase. We currently have 257 open cases, whereas within the audit, I think we had 200 open cases and 78 had been discharged. The majority of those discharges have moved on to adult services. The team has grown, though the children and young people's team have grown. We now have myself, who's a full-time occupational therapist lead, working within the lymphedema team. And we also have a 4-day-a-week now, a lymphedema specialist, who's a nurse by background. We continue to support all the 7 health boards in Wales. So we provide support in running the clinics, in education, and we support all the children in being seen local to home. So looking at prudent healthcare, seeing them within their own health boards rather than having them travel long distances to be seen as what was happening in the past. Something Rhian's going to talk about later on we have ongoing education with credited it's called a GORID Cymru. It's accredited qualification that all our lymphedema therapists within Lymphoedema Network Wales complete, and that's a children and young people specific recognised qualification. So all our therapists are generally adult therapists are provided with education to be able to deliver or to be able to support the national team in delivering the service. And we continue having ongoing links with national and international organisations such as the Children with Lymphedema Special Interest Group, which is linked to the British Lymphology Society and the International Lymphedema Framework. And as Rhian mentioned, St George's Hospital in London are making huge strides in the genetic makeup of what our primary lymphodemas are presenting with, which enables us to identify risk areas in children with chronic conditions that before would have possibly been considered as having secondary lymphedema. The genetic kind of makeup of these syndromic conditions and chronic childhood related conditions are suggesting that we can maybe get in there earlier with some risk reduction and preventative measures. So as we've said, we thrive ourselves about being value-based and patient voice. And as the picture up in a lot of the pictures that I've included here are from a Lymphoedema Network Wales Day, at Lymphedema Wales, that we run for all of our patients, their siblings and their parents, that we invite to an activity day where we can share ideas, recognise that they're not alone, because a lot of feedback that we have that they don't know where the children with lymphedema. So we run a Lymphoedema Network Adventure Wales Day where we have the patient voice. The picture you can see now is one of our patients delivering a patient story, which had great impact on a lot of our younger children in recognising that, you know, the outlook can be positive. They can still live relatively normal lives and reduce the impact of the condition. We're currently looking at how we record in the patient outcome measures, as well as looking at what their experiences are. So looking from a organisational framework, are they experiencing coming within the children and young person service? Again, recognising is the CYP service doing what it says? Should we be providing, you know, services within children's centres rather than an outreach lymphedema centre and things like that? So there's some really exciting work going on. And like a lot of the research, I know the ILF has been looking at quality of life and the impact of condition is something that's really important to me as an occupational therapist. I want to know, how is this impacting? Because exactly the same symptoms can impact completely differently to different people. And that's really important to us to understand what is the impact for that specific patient. This is the feedback. We had a bit of feedback from a lot of our patients and the children during one of the adventure days. And this is the feedback we had. Apps and online tutorials, with the kids with the electronic age, that they want everything on iPads and phones and easily accessible. They wanted better information on websites for children and young people. Something that the children and the parents identified, that they felt that other healthcare professionals, GPs, other healthcare workers, to be able to recognise lymphedema more, so upskilling and educating of them. Trendier garments, as I'm sure all kids would love, football, superhero garments, and even to the point where, you know, compression clothing, such as like jeans, which look like normal skinny jeans, can provide compression, and then onto shoes, wellies. So the parents, again, feeding back that the professionals' knowledge of lymphedema they felt was something that needed addressing. Better peer support and greater support for parents and carers with self-management and education, which again, we are really looking to how to develop our service. We're not just doing to, we're doing with, we're educating, we're working out what they need and providing them with that information. So a question that I'd like everyone to have a little think about. So our children, I got my thing, our children, young people or small adults? Question that I think everyone that works within pediatrics and children and young people would like to ask. So to think about answering that, I come up with a couple of questions. Do we do anything differently when we treat, when we engage with children to small adults or young people? Do we use different tools or resources? Do we just see children in a treatment room, in a blank treatment room that you would see an adult? How do we assess children? Do we go through questionnaires? Do we just make some observations, sat on a plinth, sat on a bench? How do we learn or take information from them? Do we talk to the parents? Do we enable the child to kind of allow us to understand the impact on them? Or do we allow the parents to talk for them? How do we communicate with them? Do we change our tone? Do we change our terminology that we use? And how do they communicate with us? I think all of those questions, I think of that all of the time because we see adults as well. How do I change? And I think I do it quite naturally because, you know, I'm a little child anyway. I love kind of working with children because I can be myself around them. For me, children are not small adults. Children and young people are not small adults. They're children and young people. And this is why I think so. Play. There's so many observations and so many treatment plans, and there's so many benefits of using play as an approach. From this picture, you can see again from one of our Lymph Adventure days, how many observations can I make on these children on the impact of lymphedema, how confident that they are, what clothes are they wearing, what functional ability, what functional impact is it having on them. And also I think, like I said, working with children, everything's got to be fun. Everything has got to be fun, and you can get away with making everything fun, which is probably why I work in this field. So, okay, so the resources that we use within children, I was going to play this video, but I'm obviously talking way too much, and it's a really funny video. And if anyone's seen the kids do the funniest things on TV, it's excellent. So we've got some pictures again from our Lymph Adventure days. From the picture you can see up on the left, I can make loads of observations of this child on how they're balanced. What is their core stability like? What is the impact of this one? And if they've got lower limb or upper limb, how are they holding the ball? Loads of things just from an activity. From younger children, how are they weight bearing? How are they developing? Are they developing at different stages? Are they reluctant to use the affected limb, or are they feeling any kind of sensory kind of feedback from that? Gross motor skills, balance, coordination. You know, we often get feedback that limbs feel heavier than the other limb. Is that impacting on gross motor function? And all these can be done through play, where, which we know children learn through play, children communicate through play. And then this last one, interaction and having fun. For me, interaction and having fun is the main thing. Unless you've got that rapport, I think, especially with chronic conditions, self-management and education can be far more beneficial when you've got that engagement and you bring in some fun element into what you're asking them to do. So like I've said there, balance, weight bearing, functional movement, interaction and role play. How good is role play within children? So thinking about trying to get children engaged in a therapy plan, that would you just say, yes, you have to do this because this will help with lymphedema? Or can you bring in role play? Something I do quite often, and kind of try to relate something to what I'm trying to get the child to do. So I would use superheroes, I would use Minecraft, I would use all things that I've kind of done a little bit of research about in what kids are doing, and relating to that really kind of gets them engaged. So where are we going next? A lot of the stuff here is about raising awareness. So we're trying to address all the things that's been fed back to us, and also what's kind of led us to a little bit of research. So we've just developed a raising awareness document that we're going to release with and launch with an electronic version and a hard copy. So we're going to supply all healthcare professionals, education settings with all this raising awareness, just because to say, do you know about lymphedema? Because very often some people don't. Did you know children can get lymphedema? And did you know that there was a child-specific lymphedema service within Wales? Again, trying to reduce the time that these children are having the onset of lymphedema to when they're being referred to us. We're seeing them earlier. People are already understanding what that could be lymphedema. Let's refer them. We've completed an e-learning module, which is, again, kind of readily available on e-learning sites, on lymphedema sites, the links, and we're more than happy if anyone would like to get in touch with us through email. We're more than happy to share these resources with us. We've recently completed a podcast. Cardiff University during lockdown was using a podcast as a way of reaching out to more students and more people, the general public. So you've just finished a podcast which is due to be released on Apple Music and Spotify, just readily available to everyone. I'll leave the research bit to Rhian, because she knows far more about research than me. Education, we're just making links with the universities in Wales, and we are delivering lymphedema sessions to the healthcare professional courses. So we're looking at occupational therapy, physiotherapy, radiography, paramedics. So we're trying to deliver lymphedema knowledge at an early stage when these healthcare professionals are doing their training. Inclusivity, that's what we're all about. It's about, you know, everyone being involved, you know, the parent, the child, the siblings, everyone. And we're due to receive some healthcare professional students starting in October. We've had nursing students over the past, but now we're trying to get into the therapies. So we're having OT students, paramedic students, physiotherapy students. So lots have gone on. Apologies if I've talked a little bit too long, or if I was talking a little bit too quick, but I'm just really excited about the impact that we can have on these children that are in the community living with lymphedema. And I think now, I'm really looking forward to some questions. I think we'll have questions later on after Rhian has talked through the research part. Thank you very much for listening.
Thank you, Mr. Carl-Austin.
Okay, so I'll leave you, Carl, to flick through as I go through mine as well. It'll be easier that way. So this is our current project. We're not saying that we have everything right in Wales, and please don't think that we do. But what we're very good at, I suppose, for our little nation is that we're very reflective and we're very kind of practical and problem solving, and we just want to know what it's doing and what can we do. So if we go on to the next slide there, you'll see that as a researcher, I'm very lucky to be paid to be working in lymphedema all the time, because Lymphedema Wales, and I'm not the only researcher, Lymphedema Wales has a whole portfolio of really practical research. Now, you know, the people listening here, and we're in lymphedema, so that in response to the question, do healthcare professionals need to know about lymphedema? Well, of course, we'd say, well, of course they do. But if you're a healthcare professional working generically in the hospital or out there in the community, you're having to deal with tens of thousands of different conditions, and particularly childhood conditions. There's so many out there. So healthcare professionals would say, hey, come on now, get practical. We haven't got the time and resources, and we have other priorities. So let's get practical here. Now, luckily, in Wales, we're really good at being practical and pragmatic, and that's why our research tends to be of the practical sort. And we just ask practical questions like, well, what can we do to improve the experience of lymphedema in children and young people? We already have started, as Carl was saying, listening to them, the children themselves, as well as the families and other carers involved in that programme, about their experience within our service. You know, did we do well? What could we do better? What are the problems? What really is it about this that bothers you? Because that's what we want to help you with, not what we think from theory that should be bothering you. What are you saying? So we're trying to listen to that already. And from that already, we know that our therapists have things that they want education in. But as Carl was alluding to, there's already a long journey for many, many people, and many of you that are listening to this probably, there's a long journey before you even get to that expertise. So can we do anything about that? So what can we do about that? Let's go on to the next slide. Oh, first of all, because the parents are saying as well, if only more health professionals knew and understood it. Okay, let's go on. So this is the project. Now, I can't just go out there and start preaching about lymphedema, much as I'd like to. There's a very noisy world out there in the business of healthcare education, and there are lots of competing priorities. So as a researcher, the first thing I have to do is take a step back and think, how do I show that there is a need first? What research has already been done, because there's no point me doing something that's already been done. What have people done with children and young families to find out what the impact of lymphedema has been on their lives? And does that show any sort of indication to us that there is an education need out there? And has anybody asked the healthcare professionals themselves, what's the problem when you're trying to look after young adults? What's the problem when you're trying to look after babes or young children with lymphedema? What are your concerns? What are the complexities? What can we provide for you that would help make that treatment easier and the onward referral to other specialists perhaps? So inevitably, the first thing you do in research is a literature search. Let's find out what's done. So if you go on to the next slide, you'll see that really, first of all, to answer the first question, no, nobody has looked at this already. So we do need to do it. And in the literature, what you find is that there are two types of story coming out. One is that the researchers have been asking families to describe that long and difficult journey. And it does show almost in every country that diagnosis has been delayed, and that delay has cost that family emotionally, financially, physically. The condition is worse. And they've often been passed from pillar to post, as we would say in Wales. They've been passed from one specialist to the other, sometimes with being palmed off with some other diagnosis, or with saying that they'll just grow out of it, or with all sorts of treatments that haven't really made a difference or have cost the family a fortune. And then there are papers that have spoken with healthcare professionals about the difficulties, but not really drilled down to what education would help them to sort that out. So we can come in at that point and try and find out what that education need is. But at the same time, you'll see on my balance beam here that whilst we're finding out there's a great lightness of weight on the education need side, there's a heavy weight now building up of improvements in knowledge that we have in terms of the knowledge we have, our understanding of childhood lymphedema. We know a lot more about it now. We understand a lot more about it now. So even those people who trained 5 or 10 years ago in lymphedema, they're maybe not up to date with the latest things, the latest developments in childhood lymphedema and what we could be doing in terms of treatment. You know, do we just start off with the gentlest garments there is? Or do we go with quite strong garments as you would with an adult primary care person? So there is actual substantive knowledge developing there, and the education doesn't balance it there on the balance beam, because actually people are very busy. The time resources are few. So what we need to know is what's the minimum that somebody needs to know and understand if they are going to manage that child better. And that's what our project is really all about. Now, to get a better understanding of that, the next thing we did, if we go on to the next slide, is that we had a focus group discussion with a big group of all the experts in the UK about what their education needs are and who they think needs educating and what sorts of things they need educating in. Now, of course, any good discussion is going to raise more questions than it answers, and that's great. I know it doesn't sound good in research, but it is. And some of the questions that were raised was, should people who are these lymphedema people who are looking after children and young people, should they be pediatric trained first? Or should they be lymphedema trained and then gain that pediatric experience afterwards and get certification maybe in looking after children? You know, what do people think about that? Can they just transfer that learning from having treated adults for the last however many years? Can they transfer that knowledge to children? In what way does it need adapting? What's clinically different about treating children and young people? And as Carl was alluding to, does their approach need to be completely different? Should the children be seen only in specialist centres, or can they be seen out in local branches, as we're trying to do in Wales, with sending into specialist centres only when it's needed? So when do you decide when it's needed? Well, you need training in that, surely. Does the diagnosis need to be done only by a medic? Now, sometimes for insurance purposes, or in some countries, because of legal reasons, it has to be a medic, a doctor. But in some countries, it can be a specialist who's built up their expertise. And in fact, somebody like Carl, who's working in pediatric lymphedema all of the time, they'll know much more than most doctors about it. So how do you access that expert opinion? How do the healthcare professionals who are working locally with the families access the expert opinion? How does the family access the experts? One of the things that was found previously in research was that the anxiety levels were really high in families that had these children. And one thing that made a big difference was just having accessibility, just having somebody on the end of the phone or the email that they could ask these issues to. Because you know how it is with children. Problems arise quickly, and quite often they can go away quickly, but you need an answer. So how can we learn to manage those children, and how can we better manage them, help them to manage themselves, especially as they become teenagers? They're transitioning into becoming young adults themselves, and they want to be independent from their parents and their carers. But you know that when they are struggling with their condition, they can really need to resort back to ask somebody again, and they need to feel that that door is always open. And how do we work with the family, as Carl was describing, rather than work to them or at them? So we're learning, we're also, because of our family events, we're learning from the families themselves. And one of the things the research showed was that sometimes the local therapist can be kind of stuck in the middle. They're having to relay information from the expert centre, perhaps, and then the family really knows that condition well, or the child knows that condition well. So they're trying to interpret that with the expert opinion that's coming from the specialist centre. Or sometimes the family has gone straight to that specialist centre, and the therapist is out of the loop, and they're busily trying to catch up with where their role is in that, and how they can better support the family. And one thing's for sure clear in all of the literature is that there's such a wide range of healthcare professionals involved in these families, especially if they have syndromes. They may be going backwards and forwards to lots of different clinics all of the time. How can we make that better? Can we get all the specialists working together better? Can the specialists be more aware of what each other's roles are? And can we avoid things like nail care, where, things like toenails, where the different professionals are advising different things which might conflict with each other? So we need to be better at this, and maybe central information where those health professionals can access information is as useful to the health professionals as it is to the family. What's clear to us as well is that the healthcare professionals, even at specialist level, they have a wide range of needs themselves, and they learn in lots of different ways. They want more ways of learning. So it's not just your generalist, your family physician that needs access to information. It's those high-level experts as well. So if we go on to the next stage of our study, then this is what we would like you to be part of. Not so much in that the next stage is an international survey. We don't need the families to be answering this survey. What we would like is for you to help us make the healthcare professionals aware that this fall, maybe into the winter, because there's always holdups, but this winter that there will be a international survey coming out online by hyperlink. We'll let Lymphstrong have the link as well, so that it can get out there to the health professionals. And we're going to use what we've found in the literature that's already been published, what we've found through our research, what we've found through our certified programs in Wales. And we're going to put all that into a sort of survey so that we can find out what the international needs, because the needs will be very different. We know that. France is the only country that has a protocol in managing children with primary lymphedema. So we'd expect the responses perhaps to be a bit different there. In some of the countries where filariasis is endemic, there'll be different responses from there. So what we want to do is find whether there's a core need out there from the healthcare professionals that are working directly at local level with families, and from the specialists that are maybe in specialist centres. What's that core need? And is there something we can do about addressing that? Is that online information? Is it certified courses? Is it face-to-face courses that we can provide in different places all around the world? And what can we do? If you click it again, Cal, please. What can we do to lend a hand? So this is where we're asking you, can you make your healthcare professionals please aware of this survey when it comes out in the winter, so that we can help you. You can help us lend a hand. You can help us you can lend us a hand. We can all lend each other a hand. And I think now, Veronica, we're open to questions.
First of all, I'm incredibly honored and humbled to have you both present here today. I personally, sharing just a bit of my personal story, I'm third generation lymphedema distichiasis syndrome. Both my grandfather and father had it, and it took about 25 years for my father to get diagnosed. And we were diagnosed by a billboard on the freeway. And we both went together to that initial appointment. And at the time, my onset began at the age of 20, but at the time I was 24 years old. So I would have fallen under the CYP program that you have there in Wales. And that just makes me incredibly emotional, because back then they decided to treat my father, but when it came to me, they said I was too mild. That I didn't need treatment nor education because I would never be as bad as my dad. Fast forward 25 years or 20 something years, and I could fit into shoes. So this program is very, very, I'm going to spread the survey as far as people will probably get annoyed by me when I'm going to just share the link, because it's, I'm convinced to the points that Carl raised, my quality of life would have been better, my clothing, everything. I think my life would have had a very different trajectory, and I may not have even founded Lymphie Strong, but it's incredibly important that people have this training and get this survey done. We're going to start with the questions now. If I encourage everyone on the attendee list to please, your question will be anonymous. We won't mention your name. Drop it in the Q&A. We're going to have about 15 minutes, so about to the top of the hour. I'll go ahead and start, because I was writing a lot of notes as both of you were speaking, and some observations that I made are that I had a question on one of the slides that Carl had. I noticed that there was a program within the British Lymphology Society. I think it was CLIS.
Yeah.
Can you tell me more about that?
Yeah, it's a special interest group that's made up of all the experts that are working with children and young people services within the UK and Ireland and Australia. We got representatives that are out in Australia working as well, and it's it's a national group. Then it's a specialist group that provide support, training, raising awareness. They also run a thing called this Lymphathletics, which is very similar to the Lymph Adventure Day that we run. And they are linked to BLS as well. So within all kind of the BLS frameworks that we're represented, which again is really exciting. The children and young people are represented in these wider organisations, which I think can only be good, And even in the upcoming BLS conference that is online in October, there's a specific sessions available for children and young people, which is just great. On a 2-day conference, we've got a couple of hours that designated to children and young people. Who would have thought that? So yeah, if anyone just kind of search for Google children CLSIG, it would come up, but it's the Children with Lymphedema Special Interest Group, and it would come up through all searches.
Okay, Children with Lymphedema Special Interest Group.
And they have a website which provides information and guidance and resources. Again, but if you don't know about it, and you don't know you've got lymphedema, how would you know it's going to be any of use to you as well, isn't it? So it's only the people that know about it that know about it.
Yeah.
So we're trying to change that.
One of the really important things about that is that it allows a safe space for all the professionals, the therapists, to ask those questions that maybe they're too embarrassed to ask others around them about. So, if you're in a busy hospital and you're a bit intimidated by the vascular surgeon or the pediatric or the dermatologist consultants or something, to be honest, a lot of the guys there are so expert, I don't think they'd be intimidated by them. But it can be difficult to ask a question like, I've noticed that a lot of my families that have dystichiasis in it, is there a genetic link? There's a lot of them with congenital heart problems. Is that part of the genetic pattern? And they're really very clinical questions that you can ask, but in a safe space, because all of the others there are lymphedema trained, certified therapists who are working with children a good amount of the hours, not maybe full time, but good number of times a week they will be seeing children and young people. So, and in the absence of national protocols and national guidelines about how often garments should be changed, what millimeters of mercury should they be, is there a particular cream, should we be stopping them from playing American football or something, when there isn't a clinically research-based guideline published out there, who are you going to ask? You have to ask your very experienced peers that are around you that are also, still struggling and learning. And that's really where we're at now, where that consensus view that's shared on their website and was originally in those ILF documents that were about childcare. That document is now over 10 years old. And it was consensus-based, and it was the best we had at the time. But, we've moved on, research has moved on. So, and that's why France has been able to publish a protocol. So we're quite excited now. We hope that more position statements will come out as more and more evidence comes out. And I suppose that's maybe something that could happen in the States. I'm not aware of there being a special interest group for therapists who are treating children. There may be, and I apologize if there already is, but I would encourage them to kind of link up and do that. Because of the genital edema Veronica work that I was doing, the ones in Australia are linking up a lot more strongly now. So that's really great.
Well, that was going to be my natural next question is, if you knew of any contacts in the United States that were working on similar projects.
There are people doing, there are people treating children, and there are people doing studies, but I don't know for sure. But there's something we can find out for you. There's a little bit of homework for you, Cal. We can find out if there is a collective of therapists who are sharing their knowledge on childhood lymphedema in the States.
And if there isn't, we can sound the alarm to contact Carl and contact your team about
but we will be at the international conference that's over in Denmark in November. Again, talking about childhood lymphedema and things. So we'll be able to get people a lot more networked up again there as well. So that'll be a good opportunity.
Absolutely. We do have one question in the Q&A. I'll just read it out loud very quickly. What age groups were included in the prom? Curious about how you get children under 2 to rate their symptoms and pains.
Yeah, absolutely. And that's something that we are looking to develop all the time. I think it's a little bit inconsistent, to be perfectly honest, in what age groups we deem are unsuitable or not able to report on their feelings. So if a child is unable to communicate or unable to report to us, we would speak to the parent. We would speak to the parent on what they interpreted, because they're with this child all the time. They'll be able to kind of report similar to the things that I was talking about, how useful observation is and how useful play is. So what we would do, I would use play and my observations during my session to I try to identify what the impact is. Obviously, these children are not able to report. So it is kind of age specific. So you need the cognitive ability to be able to understand what the questions are asking you. We are looking to devise at the moment more younger child friendly. So we may have 3 different versions of asking the same question in regards to age related. If you think about the over 18s now, what we've decided on doing is for them to use our adult prom that we're using, which again will aid the transition through. It's age appropriate, and it's a language that they would recognize. So an answer to the question is, it's really difficult. It's really difficult. So we're not doing a great job at the moment in accessing what the impact of lymphedema is on these children that are not able to communicate. But where we are not able to get the feedback, I use my observational skills and feedback from the parents in how is that happening? Is it impacting on development? Is it impacting on any of their fine motor development? Or, they know when their child expresses pain. Do they feel pain? Do they feel different sensation? And a lot of that can come through observation. So that's a really useful skill to have. So I'm not sure if I've answered your question. At the moment, we'd love to be able to, but I'm not sure we're going to get accurate kind of measurements from that age group of children.
And the other thing, sorry, go on.
I was just going to say, we do have parents in the webinar. And so this is useful information to them.
Yeah, absolutely, yeah.
The other thing to remember is, of course, the youngsters, the really young ones, tomorrow doesn't exist for them. It's only here and now. So, that's why we tell them about just something is going to happen in a minute, or just after tea, or after one sleep, because tomorrow doesn't even exist for them. So why would they, why would we tell them to prevent something? Because that's meaningless to them. Only now means, talk about being mindfulness. The children are there now, here, and that's all that matters. So we have to adapt how we speak to them, but also what we're measuring, because they can only tell you about now.
That's such a wonderful response. I love that. Next question is from a parent who's been in my group for several years now. How common are lymphedema pumps for at-home treatment, and at what age?
I'm not so sure there's a specific age. I think it comes down to size. Rhian may be able to correct me with this, because she's got a bit more experience in regards to. So we're talking at like lymphocysts and stuff like that now, are we? Are we talking about home massage kind of pumps and stuff like that? I would say late teenagers are the majority of the people that I've been involved with that have used it and are of benefit. Again, there's no funding for them in Wales at the moment, so the parents would have to purchase them. And for us to kind of recommend them, it would always be at parents' discretion, I suppose. So I would say, mid to late teenagers into the early adults are what we would suggest in regards to their development, and they're still kind of growing at a younger age. If there's anything different to that, Rhian, I'm not sure.
Yeah, we're much more likely to, if you think about children now, think about how they spend their time. Okay, so the teenagers will sit down and be watching, playing on the computers and watching TV and listening to the music, whatever. So they will sit still for pumps. But it's not normal for toddlers to be sitting still for a long time with a pump. That's not normal childhood. So we're much more likely to encourage something like a trampolining. We're much more likely to encourage the little ones to use a paddling pool or the bath or a swimming pool and just be splashing their feet like mad, or dancing or jumping, or it's around that. And then working with the parents, putting the magic cream on and things that dance, and all sorts of dance, street dance, ballet, anything that they're into, because they're more likely to see that as part of just being a normal child. And that's what we're trying to achieve. We're trying to sneak it in there, not for it to be therapy.
And that's where the play comes in. We want our children to be active, because there's no better treatment than being active. So they're smiling, they're laughing, they're being active. That's a normal thing. Sat down with a bit of equipment on their leg isn't an everyday activity, is it?
Okay. Next question is, I'm a GP. What would your message be to GPs out there?
Get in touch with us. Get in touch. Please refer it. Please refer it. There's one thing that the first thing I learned when I came into lymphedema is there's no such thing as a little bit of swelling.
Oh, thank you for saying that.
There's no such thing as a little bit of edema. There's no such thing. Oh, that's okay. That's only a little bit. No. Early intervention, early recognition, early access to lymphedema services is paramount.
Yeah. So certainly at neonates level, they're very young. It's really difficult to get an early diagnosis, and we can be very critical of children not being picked up until they're 4 or 5 or older. But actually, some of these conditions obviously are developmental, so they will only actually develop and show when when the child's body, their anatomy, reaches a certain level of development anyway. So, we've got to be careful not to criticize what shouldn't be criticized. Certainly, we would ask the GPs to look at families. Is there a pattern in this family? Because, we might be thinking about genetic links then. And we do send our children in Wales for genetic testing and things, as most of the UK now, if there's a primary edema suspected, then they will get that. And we definitely use the St. George's flowchart that helps us to diagnose the primary lymphodemas. And it although it kind of could look a bit intimidating when you first look at it, it really isn't. It's as simple as a flowchart can be. It's all color coded, and it's yes, no, and you follow it down, and you're down to a fairly small group of things that it could be then. And then, as Carl says, contact the lymphedema therapist teams, because as you found, you can't shut us up. We're very vocal, so we will definitely share information with you. And it's about making simple changes that fit in with life, and then them knowing that that expertise is accessible. That's one of the most important things. We love it when GPs get in touch and ask us for more information, because they are sometimes, well, certainly in the UK, the poor GPs these last 2 years have been run to the ground with COVID and everything that's happened. But we're really happy if they communicate with us and work with us, because, the families do expect them to know everything about everything. So we're very happy with signposting.
And I noticed that you have your email on this slide here.
That's why I've left it up. That's why I haven't stopped sharing. So our email and our contact details are on your, as are the Lymphoedema Network Wales, and we're on Twitter and as well.
And we'll also signpost, if you're listening from another country, we'll also signpost you through to somebody in your own country probably as well.
I stay in contact through Twitter. You and I are always retweeting each other. We're very active. Any way you want to get the message across, but by all means, email, tweet. Next question. Regarding skin changes in lower limbs with lymphedema, any pointers on reversing or improving the hardening, darkening of toes, feet, and small bumps that appear?
Yeah, I think, again, the fundamentals of managing lymphedema, isn't it? Is skin care, good skin care, compression, exercise, and some massage. I think the little bumps potentially could be like some hyperkeratosis or something just kind of starting. So again, diligent skin care is the easiest thing that we can do. So using a good moisturizer, really kind of massaging that into the skin to increase the flow, and just maintaining that. It also reduces the risk of infection. None of us have mentioned infections and cellulitis in this, which we all know is a real negative of lymphedema. So I think with that, it's diligent skin care, lots of exercises, wearing compression garments, and then just kind of seeking some advice from lymphedema specialists. We are always here. If people want to send us photos, we'll all have a discussion, and I think skin care and look at moisturizing, washing, drying, using a good moisturizer would be really beneficial to that.
And the children, they're going to get verrucas, they're going to get athlete's foot, they're going to get impetigo, they're going to get all sorts of things as they grow up. So it's just not to panic at that point. Look what the normal childhood treatments would be for those things. And sometimes, yes, you need to be doing these things for a little bit longer. It's like as if the lymphedema makes some conditions hang on in there a bit longer than they would maybe in another child, but they do go.
Yeah, we hadn't touched on cellulitis, but I'm very familiar with it from a family member standpoint.
It's a whole new webinar on its own, isn't it? Cellulitis is a webinar on its own.
My father had over 100 bouts of cellulitis in his lifetime.
Wow.
I was hospitalized 2 to 3 times a year. So it's a very, very important subject to touch on.
Yeah. And there is some evidence in the literature that it may be less common in children than it is in adults. But my response to that, well, it doesn't matter how few or how many less it is than in the adults. It's still important to that one child, isn't it? So
exactly.
What we don't want is
and to that parent. To the parent and the child. No one wants their child in the hospital or septic or absolutely.
And and we're always worried, aren't we, that with every episode of cellulitis that it's doing more damage. So yes, definitely we want it picked up quickly, dealt with quickly, and if we can avoid. But we, in Wales, the game of rugby, I don't know if you know that, it's a bit like American football, I suppose. We let them play rugby, we let them play hockey, we let them play, we do, but we have to deal with anything that comes from that. The swimming pools, they have chlorine in them, but there's all sorts of bugs swimming around there. But they have to have a normal life, but we might just be a bit more diligent with the shower and the creaming and things afterwards, that's all.
And I think that answers one of the questions I've seen in the Q&A. What message would you be given with a parent with an 8-year-old child with lymphedema? And exactly that, what Rhian says. Don't turn every day into a therapy day. Let them live, let them develop, let them grow, let them do everyday activities all children are doing. But like Rhian says, sometimes it's just about being a little bit more diligent. So good skin care, exercise and activity, which hopefully the children are doing, wearing compression if that's what's needed. And then just being a little bit careful if they get scrapes and cuts and bruises, just kind of watching them and making sure that there's no infections and that they're clean. But I think it's a really important message that let's reduce the impact of lymphedema on these children. Let's let them live, let's let them develop. And then we can, we can build all the strategies into everyday life.
Carl, I'm going to ask you a follow-up question to that. What about mental health as far as dealing with other children who stare, or the common question of Why do you wear that garment?
Why are you wearing
All
that?
of that is,
Absolutely, yeah.
is
And
that
I
a
think
component in the CYP?
Very much.
Okay.
And we know for children with anything, children can be really cruel, can't they? And children can be very self-aware. And the psychosocial and the psychological aspect of dealing with lymphedema is way up there in the impact, which doesn't always get a lot of attention, I think, And I think, again, it's just around education, the support is there. If a child feels comfortable in telling people or understands what they got themselves and they're able to tell people, I think that really reduces the anxiety and the psychological aspect of it, as well as things like support groups and stuff like that. A lot about what we do is enable children to meet people that have lymphedema like them, because if healthcare professionals are not sure what it is, other children are not going to know what it is. So again, it's about recognizing that they're not out there on their own. There are those support networks, and which allows them to be with like-minded people going through the same experiences as them. But very much so recognizing, educating the families that the psychosocial is and psychological aspect is something of is an impact on the children, and just allowing them and support and that time to kind of talk through. So, for instance, something like in the CYP service, if I was doing an outcome measure, if I was doing a prom, and the child was identifying that their mental health or suggestions of their mental health would affected, that would be my session. We're not a measuring service. We're not a service that just has to deal with their lymphedema. For me, that would be my role within that session is I'm just trying to understand. So what is that? What is it? So why? And a little bit of CBT, a little bit of cognitive behavioral therapy, which is kind of a little bit about my background within mental health as well, in recognizing, so what is the problem? Is it just that they got lymphedema and people making comments on it, or is it more of an educational and an acceptance kind of issue? So we support the child, we support the family, and we're doing a lot more education in schools. So siblings are kind of recognizing what lymphedema is now. So hopefully, it's always going to be there. Psychological impacts of all chronic conditions are always going to be there. And even children without any chronic conditions, can find difficulties. But I think there's definitely a major role within CYP services that we need to recognize the psychosocial impact on the children.
Absolutely.
I'm encouraging Cal to publish next year on play therapy and lymphedema, and I think that will open up a lot more discussion as well, because that I think there's a lack of recognition of just how important that play environment for the children is. People say, I see the children in my clinic, and you realize what they mean is the adult clinic with the white walls and everything, and there is nothing relaxing or anxiety reducing about that environment for a child at all. So yeah, play therapy is a lot more than that, and that is certainly the mental health aspect has been spoken about in other long-term and written about in other long-term conditions. So I think Cal would be an eye future in that one.
It's an ongoing fight that I'm having. An ongoing fight that I'm having at the moment is to see these children in the right environment, in the right surroundings, to be able to, reduce anxiety, reduce any kind of psychological impact, and allow them
and role players, as Carl was talking about earlier, the role play can help them build themselves a little armory of responses that they might have to different scenarios. So role play can be really useful like that. But on our family days, when you see two 12-year-old girls meet each other and suddenly realize they are not the only teenager who wants to be beautiful and on Facebook and TikTok and everything with their beautiful clothes and looking pretty, and realizing that a certain part of their body just won't fit in with this model, and they suddenly realize they're not the only one. There's another teenage girl here who's got her beautiful hair and her makeup on, but is feeling really awful about her legs or her hands or something, and to see them speak to each other and bond. And of course, they then build up their own networks. So we know that they speak to each other and Facebook and WhatsApp and all of these other things. And it can be simple things. The families asking, hey, what football boots do you find are useful? Where did you buy them? And what sort of size? How did you deal with the fact that one foot's bigger than the other? Which companies will let you buy just one shoe? And things like this, you know, so that they share an awful lot of information that we can't always hold. We'll never know it all. So we learn a lot from the families.
Yeah, it's similar to what we do with Lymphie Strong on Facebook, even though Facebook is more for the adult. The older, I know the kids like the more hip apps like Snapchat and TikTok. So, but yeah, I couldn't agree with more with what you just said. The last question, Dr. Noble-Jones, I'm interested to know if diet has an effect on lymphedema with children. Did you find anything about this in the literature?
It's not so much. Well, yes, the quality of research is poor. Is the first thing I do have to say. We know that if we let the children become obese, then we are setting them up for a really hard fight later as they become older and into adulthood, because we know that the obesity just makes the whole situation a lot harder to deal with. But other than that, it's a good, balanced, nutritious diet, really. Whichever way around, you come around these things in circles and you end up really in the same place. There are some specific conditions where the digestion just can't cope with certain types of fats, and then they need to be on a special diet. But all of the others, really, it's just a healthy, balanced diet. And again, getting that variety in so that their microbiomes are healthy in their bowels, and they're getting the vitamins in, and that, you know, we want their skin and their nails and their hair to be as healthy as possible, so that it has to go in, you know, the fuel has to be good in the first place. But if we're making them obsessed about their diet and on a completely different diet to the other kids that they play with, then again, we're singling them out as being different and setting them up to be picked on again. So, you know, again, it's that thing of trying to make everything normal and as similar to their siblings as possible, because there's a whole other agenda of what the siblings go through, and all the attention is on one sick child, of course. Does that answer that one?
Oh, let's see. We've got two more. We've got one more question and then a general comment. Is there any information on children with lymphedema and getting the COVID vaccine? I'm scared that not enough research on the effects has been done to our little ones.
Okay, that's a tricky one, isn't it? So, they're being very reluctant in the UK. The debate literally today is about the sort of 12 to 15-year-olds. And so for that age group, what we're seeing is really minimal problems from other countries. And so we've got one body saying that if in terms of the vaccine alone, it's not worth giving it to 12, 15-year-olds, but from the bigger picture about who we're trying to protect and what we're trying to protect them from, you know, in terms of saving our health service and not blocking up the health service from being able to do what it needs to be doing. Then there is a counter argument that the 12 to 15-year-olds should be vaccinated. Certainly worldwide, I'm not an epidemiologist, so please don't take it as that I'm the expert on this, but as Veronica will know from my Twitter feed, I read an awful lot of the experts, and it is the epidemiologists and those the vaccine experts that I do listen to, and not just popular media. And an awful lot of children have been safely vaccinated. So we can't say that thousands and thousands of young children with lymphedema, with the particular syndrome that perhaps your child has got, has been vaccinated, and therefore we know that they're safe. We can't say that, because, you know, the vaccinated group is a proportion of the population. The ones with lymphedema is a proportion. The ones with the same condition exactly as yours, will be a very small amount of that. So we haven't got enough numbers to categorically say that it would be safe. But my feeling is that if they got COVID, it would be a lot more dangerous to them, to their lungs, and the danger of long COVID is a very real danger to all of the children. So that's where I'm on it. As a grandmother and a mother and a stepmother, that's where I'm at it on it.
Absolutely.
Right.
I agree.
The final comment is a great webinar. Thank you, Veronica, Dr. Noble-Jones, and Carl. Well appreciated. Another comment, great job, Rhian and Carl. I want to thank both of you for being with us today. We're right at an hour. As I said earlier in the webcast or the Zoom, I'm humbled and honored to have you on both as guests. This topic is very near and dear to my heart as a third generation lymphedema patient. And I hope that everyone that has any questions reaches out to both these individuals, or at the very least, emails Lymphoedema Network Wales at wales.nhs.uk. Feel free to tweet if needed. And just a reminder that everything presented in the webcast is for informational purposes only. No one is here to try and diagnose or treat anyone or dispense medical advice. It's just an opportunity for everyone to become informed and go forward on their own path. Sorry, my headphone just fell out. So if you had any final comments, either of you, I'm gonna close out the Zoom.
Just like to thank you, Veronica. I know it's not easy to keep the momentum going all the time with these things like webinars and websites and Twitter and all of the rest of the things that you do. And just to point out to people that there is no funding for Carl and I when we do these things on the weekend. This is our thing. But similarly, importantly, there's no funding for Veronica to be doing keeping and maintaining her websites and webinars either. So I'm sure there's a means of doing a voluntary donation that Veronica has on Livestrong, and I would encourage you to thank her for things like this with a few dollars. Thank you.
Thank you so much. Appreciate that.
Yeah, me too. I would just like to thank Veronica for the opportunity to share our experiences in Wales and to preach the CYP lymphedema fight, because again, hopefully in a few years that it would be as commonly known as adult lymphedema services and other chronic conditions. So that's the aim. Let's see these children earlier and make a difference earlier in their lives.
Thank you both. And I want to thank let's see, got one more. I want to thank everyone who attended this webinar. I know you have a lot of things to do on the weekend, and it's a Saturday. We thank you so much for your questions. Thank you so much for your support of the Lymphstrong site, and of course, the Lymphoedema Network Wales. I'm wishing everyone a blessed Saturday, and I'm wishing you great lymphatic health. Thanks. Have a good evening.
Bye-bye.
Bye-bye.